Many times there hasn't been an event where a loved one is now in the hospital or something like that, but I came to visit and I just noticed that things are a lot different and I'm very concerned about my loved one's safety and well-being. What things can we do to help with that? Hi, I'm Phil Natsiopoulos, and today we're going to talk about how to navigate care. Number one, assessing the needs. Many times I will get a phone call, and what I like to do is really kind of get the person to the place where they're answering one simple question: why did you call? Which means you're seeing something and maybe I'm scared, I don't know, but so I want to figure out with you, what are you seeing and why is it important to you? Okay, the way we break down home care, and any kind of care for that matter, is two acronyms: ADL and IADL. ADL stand for Activities of Daily Living. So to determine where someone's acuity level, we'll say, is at for an ADL. ADL just means when a person stands up and sits down or lays down in bed. When a person ambulates, moves from one place to another, and how do they do that safely? When a person has to go to the bathroom, can they go to the bathroom safely getting on and off the toilet? Do they not make it to the bathroom in time and have problems with incontinence? When a person needs to bathe, are they able to safely get in and out of the shower and know that there's not a fall risk doing that? And same thing with getting dressed. Can they use their hands and thumbs and fingers to get clothes on, comb their hair, brush their teeth, those different things? And in some cases, when we're looking at that, it may be that they have nothing wrong with their hands or their fingers, but maybe there's something wrong cognitively where they're just not kind of remembering what are the steps to do this, because there's some other challenges that we're looking at. So we want to ask questions along those lines. How can they safely be alone and do these normal activities that all of us do on a daily basis? The second acronym is just one extra letter with the letter I, instrumental. And it just means, okay, along with these daily bodily things that we do, what about running errands? What about cooking meals? What about keeping the house clean? What about remembering to take our medications on time? What about traveling? There's other things that we're doing that are instrumental to how we live on a daily basis. We also want to be able to look at that and say, okay, it looks like these things are not safe for them to do without some help. Number two, schedule a needs assessment. So when we come out after, let's say we had a conversation on the phone, we want to come out and do a couple of things. One is put our eyes on your loved one in terms of how are they doing, how are they functioning, how are they communicating with us. Also, we want to do a safety evaluation of the home. With the given set of circumstances that are going on, is there a safe environment? We look for things like throw rugs and other things that can be a factor in falls. And falls mean so much in terms of living safely in the home, especially for a senior. Once they pass the age of 75, there's so much documentation out there on how big and important it is to make sure we're free from falls, or at least we've mitigated as much as we can to be free from falls. Once we've been able to put the two things together, then we can go forward with coming up with a plan. Other things that we want to look at is the height of the bed. That used to be no problem, but maybe the bed is either too high or too low for them to safely get on and off. And also we want to go into the bathroom and look at the same things with a shower, bath, sink, and toilet to make sure it looks like a safe environment. Number three, what are your resources? And what I mean by that is, what ability does your loved one or your family have to private pay for care? So when looking at these things, it helps us also help navigate what that next step would be. And can we come up with an idea of the amount of funds that would be available on a weekly, monthly basis to make sure your loved one is safe in their home environment? Number four, understanding care options. It's very important to understand what is out there, what's available, and that has been mentioned in other videos. What does insurance pay for? What doesn't insurance pay for? So I'd like to just go over a few of these options. The first option is home health. Can I get someone into mom and dad's home or a loved one's home that is a medical professional that can help work with them, like a physical therapist, occupational therapist, or other type of therapist, to get them stronger and better? That is home health. That is something that a doctor orders, and that is something that insurance pays for. What insurance doesn't pay for is all the other hours of the day and the week that that person won't be there. And if I want to stay home, option is care at home or home care. Many times what that means is, depending on the family and the support, it could be a combination of hiring an agency to come in with home caregivers, and at the same time having a family member or a loved one come in to take care of some of those hours too. In other cases, there isn't that ability to have a family or a friend come in, so it could be the agency's responsibility to be there up to 24 hours a day, 7 days a week. The next option is senior living that's not in the home. And these options are under what we call placement services, where if we've determined for a multitude of factors that home care just is not, or home itself is not going to be the safest place, then we can look into places to go. And that's part of what we do in terms of navigation. What are my options? There are assisted living, there are adult family home, there's independent living, and all of these are a function of living in an apartment-like environment or a home environment with a level of care, with the exception of independent living, meaning you're literally living in an apartment environment that doesn't have a level of care, but it still may have the amenities of a meal program and different things like that. The last one is respite. Sometimes my loved one isn't ready for home because even though the discharge planner is telling you they have to go next Tuesday, but you're looking at a situation, you're going, well, I don't think they're ready to go home. You may have even tried to appeal the discharge date and you can't get it. Sometimes what we can do is do a little combination. Maybe find a respite stay somewhere like an adult family home or maybe an assisted living where they can stay there for an additional few weeks or a month or two with home care, home health care coming in and continuing with physical and occupational therapy, with the idea that we can still hopefully get them to a level where they're safe to come home. Number 5, navigating insurance and payment. So now we're in a situation where there's going to be money that's going to find a way out of our pocket. We know with health insurance, it's very limited with home health services. Everything after that, there has to be a different resource to pay for it. Many times it's private pay, it's coming right out of the pocket. There are other things to look for. Maybe you didn't realize this, but mom or dad or that loved one, they actually bought a long-term care insurance policy, which can pay for a number of hours per day of the home care services. So now you're not having to pay the full amount because they've been paying into this policy. The other great benefit that's out there is there's a VA benefit, Homemaker Home Health Aid Program, where the VA will actually grant up to 56 hours of care per week for a loved one if they meet the criteria for that. Lastly, there is also government Medicaid that gets us outside of the realm of private pay, and that puts us into another place, but there is a Medicaid benefit out there for people if they qualify to have some of their home care expenses and or senior living expenses paid. Number 6, getting support for yourself. Most of us, when we start this journey, feel this amazing burden that I have to take care of everything, and if I don't, then I am a terrible, terrible person because this is my responsibility. And I can tell you, I've lived that way with my own parents, and I know what that feels like. But really what's important is to know that there are support groups out there. You can find people that are going through the same thing, and there's something magical about talking things through with people who have gone through or are going through the same thing. There are family and friends. Talk to somebody in your family or a friend, like let them know what's going on and get help and get that feeling of like, okay, I know I'm not alone here on this island. Lastly, if you need to, there is professional help too. If you need to find a therapist or a counselor just to talk these things through. Caregiver burnout is a real thing, especially when it's a family member, because you've lost some of your identity in your relationship. You used to be son or daughter or husband or wife. Now you're caregiver and son or daughter. So talking through those things with a professional can be a very helpful thing. To learn more about working with us, please go to www.alwaysbestcaretacoma.com.